Osteopathy and craniosacral therapy for babies. In this video, I want to teach you about fetal positioning and the important influence it can have on baby, and how, as an osteopath or a craniosacral therapist working with babies, we can help those babies. Now, if you're a parent, most of this video is not for you, but watch the first 3 minutes, because that part you can apply to baby without any prior knowledge, so it's going to be really helpful for you in terms of settling your babies. So we're going to cover two things. One is settling baby using their fetal position to get into a place of comfort. And then the second half of the video is talking about unwinding that fetal position and getting baby back to a neutral or a normal. So, right, let's just dive in here and get started. Now look at these pair of legs. These legs is 54 years old. Even though that amount of time since they were born, fetal positioning is still influencing them. These are my legs and I have no problems with them. My health is very, very good. However, when I sleep like this. Always sleep like this, because there's a deep unconscious patterning in my body from when I was in the womb. When I had the one leg crossed over the other, there was a sense of comfort for me. And so when I'm go to sleep and I'm kind of going into that deep state, that is the position I like to go into. And that is crucial. So that effect is still there 54 years later. So imagine how strong that is with a baby. Look at this baby here. Look how strong that is with this baby. They're coming towards this one side. Hugely. Why is that? It's because that's the position they were in the womb. So later on in the video we'll talk about the techniques of why that happens. But if you're a parent, I just want you to get that. Baby is going to be more comfortable in one position than the other. And so what you can do, just take hold of baby's bum and you move them to one side and move them to the other. And you see whether they're more comfortable that way or another. You push their knees up towards their chest. You hook one ankle over one way, one ankle over the other, and see if it's more comfortable one way or the other. See what their fetal position is. Now, if you can see their fetal position, then what can happen is when you're trying to comfort them, just put them into that position, and you'll often find baby just eases down a little bit, relaxes down a little bit, especially with those knees up position, because especially if they've got any wind, that can also press on there and give baby a little bit of relief from comfort. They might push back against you with their feet. You just resist. Resist then, hold that there, and it gives them a little bit to push you back, and often you'll get a lot of relief. Now, if you're a parent, you can watch the rest of it if you want, but the rest of it is going to be deep dive. Right, practitioners, I'm sure you already know where this is going. If you can get baby into that little bit more comfortable position, wow, they can accept treatment. Especially if they're a little bit grumpy, they're a little bit grizzly. Maybe we'll only do that at the start of the treatment, just to ease them into it, just to make them feel at home, give them that subconscious feeling, oh, I'm back in the womb. That's what I was doing with this baby here. I was getting them into this position so I could work elsewhere on the cranium. They felt, oh, I'm really comfy. And what I did was I got mum. Initially I was doing it, but then I got mum. I said, look, this is what's happening, and I explained to her and got her to do it and put her to put the pressure on, hold that position. So then I had both my hands free in order to work on the cranium, work on other parts of the body. Now, as we're doing this, if you explain that to mum or dad, then of course they can use that at home as well. So it's a beautiful way of letting that nervous system just relax and calm down. Now, when you're working with baby for the very first time, and so for example, this baby was the first time I've seen them, I think they were 2 weeks old in this treatment, then you might spend the whole of that treatment just exaggerating the fetal pattern. Why? Well, if the baby has a lot of trauma, then you're going to be wanting to work on first breath, shock, the trauma from the birth, just trying to get that person, that baby's nervous system to just, let go a bit, let go a bit. Let them arrive in the world, let them have some kind of like, I'm actually maybe okay with being here, rather than this kind of terror of, oh my God, what has happened? And just holding themselves super tight, fighting everything, fighting their digestion, fighting getting the poos out, fighting taking a breath, just being in panic mode. So if that's the case, you're going to judge with baby. You'll know, because when you see baby, they're doing well or they're not doing well. So if they're like that, then you might just exaggerate that fetal position, put them into that, so that then the rest of your work, it just takes a little bit better, and you're working with those more subtle things, or let's say those less mechanical things. You're not looking at, can I put sacrum here, can I work on the spinal alignment, things like that, not even the skull shape. You're just trying to get that overall system just to work a bit better, allow that baby's potency to come through, and then that baby's natural self-healing mechanism will boom, rocket it through and just really start to do a lot of the work for you. You do a treatment like that when you first see a baby, the difference is, say, 2 weeks old, you see them a week later, wow, they're 50% older. Even 1 week later, they're 50% older. Their self-healing mechanism got going. It's remarkable the difference you can see. Now, other ways to use this fetal position, it might be you just seeing the baby's doing a lot better, or it's the 3rd or 4th treatment, and you just put them a little bit into that to get them a little bit of ease if they're a little bit grumpy, to get them in the game sort of thing, and then you can move away from that and start to do the rest of your treatment. So for example, in the treatment here that you're seeing, that's what I was doing. I was putting them into that fetal positioning to get them to a bit of ease, and then I want to work them out of that fetal positioning, and that's part 2 of this video. Someone in the fetal positioning, and we want to work that out so that they don't stay in this kind of bent over position. It doesn't exaggerate the plagiocephaly. It doesn't exaggerate what's happening with the neck. It doesn't exaggerate anything that's going on in the trunk, which might be closing down their gut wall, closing down that space in the stomach, making digestion hard, closing down that left-hand side where the sigmoid colon is, causing constipation, or at least contributing to constipation. Plus, if we work out some of that fetal patterning now, when the baby comes to, in terms of crawling, in terms of walking, all of those different things, then they're going to be a lot better at doing that. Straight away, there's not going to be any differences in terms of their favouring one side. Often you'll see with a baby that hasn't worked out the fetal patterning that you get one leg that's bowed, a particular lower leg that's really bowed across the other one, and then what happens, they start to walk, that throws the gait out. Now, if they get treatment, that's great, you can work that, although it takes a lot longer to fix it then than if you fix it when they're first born. But if they don't get treatment, that can start to throw things out. Now, I'm not saying that's going to cause a scoliosis, but as an osteopath or a practitioner, you're going to understand that if we don't have a good gait and it affects the pelvis, well, it's going to affect the spine, and we can have influences later on in life, particularly as you go through those growth stages in life. Now, in terms of treatment for getting rid of that fetal patterning, I will cover that shortly, but before that, I want to go into why we get that fetal patterning, because it's an important thing to know if you're going to treat it. Because for me, it's very much like, let's talk about an adult. An adult has come in and they've had a sprain on their forearm, they've fallen, and they've got, or let's say the dog, they had a really big dog on a lead and it yanked. And yes, it might influence the shoulder, but certainly it was straining through that interosseous membrane of the arm. So that's one particular type of injury. Now, another type of injury you might get in there is a repetitive strain injury, whether that's computers or quite often people working at checkout desk at the supermarket will get those kind of strain patterns because of the way they're working. Now, the one type of pattern, which is a repetitive strain, often will take a lot longer to fix than that one single injury. Now, of course, you can have a major trauma where a fraction, yes, that will take a while, but we're talking about soft tissue injuries here. And the reason being is that with a repetitive strain injury, it's patterned into the system. It's really patterned into the system and it's ongoing. And the other thing is that it tends to stay ongoing after you treat them. So you treat them and they go back and they do the same thing again. Now, let's bring this story back to babies. So what you can have is you can have a pattern in the neck, let's say a strain like this. This is from birth pattern. So as they come through the birth canal, there was a certain strain pattern that happened through there that caused the neck to shorten on the left, lengthen on the right. Now, if we compare that to a fetal positioning where the neck is held in that same position but a longer period of time, then that fetal positioning is going to be usually far more significant and take longer to treat than the trauma from the birth. Now, obviously we have changes where you get so much trauma through the birth, you get a brachial plexus injury or all sorts of things that can have a shoulder dystocia. So we're not talking about this, we're talking about comparable injuries here. With the fetal positioning, that is going to take longer because there's been more of an effect on the system in terms of shortening on one side, lengthening on the other, but also in terms of the nervous system patterning. Baby likes to be in this position because when they go into this position, they don't have enough room to do it, so they naturally go into this position. Now, if we add other things in terms of fetal positioning, what about, let's say, the umbilical cord? So the umbilical cord is supplying their blood supply. And baby wants to move around in the womb and all sorts of things that they do like that. That it likes to do. Babies like to move around. But when they move a particular way, it pulls on the cord. Well, it's going to affect the blood supply. I tell you what, baby's going to move back pretty quickly, especially if the cord is long and it's wrapped around the neck. There's going to be certain positions that baby's going to like and not like. Now that's a physical thing. It's a physiological thing, as in when I move to one position, I get less blood, I get less oxygen. And it also then becomes a nervous system patterning. Because even after they're born, yes, baby can move their head around, and obviously it's not going to affect the umbilical cord then, but baby has that feeling of, when I went this way, my O2 levels in my blood dropped. So it's going to be a pretty strong, stimulus to stay over in this direction. Now that's really important to know, because if you try to take baby over into this position, you're like, oh look, the neck's over there, let's start working the neck over to this position, let's start, getting baby back to normal, to perfect here. Baby is gonna be very unhappy with you, particularly if you do a good job and you get them from here to here and they're like this. Great, off you go baby. Baby is going to be unhappy. Why? Because they're in a position that they remember nearly dying through. That's why. Now I egg it up a little bit. Maybe it's a position they just felt their oxygen levels were dropping, but that's significant. And so with fetal patterning, often what you need to do is take longer to treat through that. You need to consider the whole pattern, not just the neck, but what was happening through the rest of the body, all the way down through the trunk. And so as I merge here and I come on to treatment and how we treat that, often you want to start from lower down and working up. In terms of the neck, definitely you want to work for the sacrum and all the way up through the body before you start trying to change the neck. Now, the reason that kind of proof of that is if you look at this little bit of footage, when we move baby and I start moving the trunk, now on the one side, look, beautiful, works really nicely, we can see that C shape all the way from the head, coming all the way down from baby and out again through their sacrum and the curve through the spine. When I take them the other way, look what happens. They don't have that C shape, they actually bring their head the other way, trying to fight against what I'm doing. And so that often will clue you into what's going on for the whole baby in terms of the pattern. So you're going to work through those hips, you're going to work through that trunk and the low back. You don't have to use cranial techniques, you can use cranial techniques if you want, but you can use kind of articulations and mobilizations and harmonics and getting baby moving. You can just start to rock them one side to the other, move them into the side they like, move them back into the side that they don't like, and push a little bit more back to the way they like, push over onto the other side, really kind of like a door. You wouldn't get hold of a door that's jammed and just trying to run at it. It's going to bust the door or bust your shoulder. You get hold of the door and you just work it back and forth. Can I just free this up? Can I kind of unjam this door a little bit? And you get a little bit of movement, more and more. That's what you're doing here. Patterning, unpatterning. Now, you're on a double win here. Because even, let's take the neck, because it's easy to see rather than down here. So let's say we're over here. Let's say you get a win this much. Not very much, is it? Just this much. But you've got double win. One, because baby can move into this direction. Yeah, which is great. But double win because now baby feels safe moving into this direction. And because they move safe into that direction, the nervous system starts to shift. And you open up this window because the nervous system is learning all the time. Even as adults, the nervous system is learning. As a baby, it's just learning minute to minute, second to second, change. Which is why it's so great working with babies, because boy, you put a little bit in, you get a lot out. You get a huge amount out. So that little, maybe it's only 2 or 3 millimeters, but that's a change into the nervous system. The nervous system gets that and goes, ooh, I can move right. It's not saying I can move all the way over here. It just goes, I can move in the direction of right and I don't get pain. I don't get danger. Maybe we'll start exploring a little bit more towards this right hand side on my own. And so when you come back, you've only got this bit amount of change and you're thinking, oh, bloody hell, I'm rubbish at this. Baby comes back, they're all the way over here, and then you're thinking, how did that happen? Yeah, because of the nervous system patterning. And that's the difference to compare it to, you got baby over here mechanically by really getting them over and really working their neck. They go out with it like that, you think you're brilliant because you've got a huge amount of difference. They come back in, whoosh, they're even more over there than you were before. Why? Because you've annoyed the heck out of the system and you've threatened the system. So this is the skill and the secret with treating babies. You use all of your skill set. So you use skill sets like cranial, or I'll say wider cranial if you don't have any cranial skills. And what I mean by the wider cranial is that you're putting your hands on, you're feeling, you're trying to understand the system, you're trying to let it unwind, you're trying to let it find its balance and shift, and you're providing a fulcrum and a point of balance to do that. Kind of softer techniques. And then moving on to what we might describe as harder techniques, although with babies they're not really very hard at all. We're talking now about mechanical stuff, structural. You want to make mechanical change. You're trying to articulate a joint. You're trying to move a hip and free it up in terms of a range of motion. You're trying to take the neck, again, articulate, soft tissue. Maybe even, you can't really MET with a baby, but you can do kind of techniques like that, where you're starting to work them in these structural techniques. Now, if you can do both, that really is amazing for baby, because you get the soft stuff where the baby goes, oh yes, nervous system change, I'm happy to let you do that stuff. And then you need to follow through with the other stuff to get the spine moving, to accelerate what's happening with baby. Baby's over here, we're going to accelerate their return to the neutral. They would probably get there anyway, but, you know, do we want to wait that? No, we don't. We want to accelerate that a little bit. So that's a real key with treating babies. You take both of those elements, the functional and the soft and the cranial, and the more hard and the structural and the mechanical, and you blend them together, and wow, it is such a potent mix. Then you go back and treat your adults with the same combination, and you're like, why did I never treat like this before? I get such better results. So I hope you enjoyed this video. If you like this clinic footage, then there's lots more on the YouTube channel, and it's what we built all of the Cranial Academy courses around. I shot hundreds and hundreds of hours of footage of me treating babies in clinic, and then structured it into a step-by-step process that carries you through history, examination, treatment, so that you can really be taken from a complete beginner through to really being competent and excellent at treating babies. I can only give you so much on YouTube channel. I don't hold anything back, but it's just a case I can't structure it all. There's just so much to learn in terms of treating babies. So I encourage you, check out the other videos on the channel, and also check out those courses. I think to date now, I think 700 practitioners, other practitioners have gone through those baby courses, and we're up over nearly the 1,000 mark for the babies and adult courses. So well worth checking out. You can do them all online, and there's 30-day money back guarantee, so you can check them out at no risk to you whatsoever.